Let's talk some more about the common compartmental models we use to describe plasma drug concentration time data. The simplest model is a one-compartment model with the drug administered intravenously or directly into the blood over a very short period of time. In this model, the body is conceptualized as a single tank into which the drug is added over a very short period of time and throughout which the drug distributes rapidly and homogeneously. A two-compartment model is slightly more complex in that the drug first distributes rapidly through what is termed the central compartment, typically the blood and well-perfused organs, and then distributes more slowly to tissues that are grouped together as the peripheral compartment, typically more poorly perfused tissues. The drug moves back and forth between these two compartments and leaves the body from the central compartment. Here we see again how, if the plasma drug concentration data suggest a one-compartment model to describe the pharmacokinetics, the drug is instantaneously and rapidly distributed throughout the body, as in the picture in the top left-hand corner. To the right, you see what the concentration time profile would look like. Concentrations start high and decline steadily in an exponential manner over the entire sampling period. On the other hand, if a drug's pharmacokinetics is better described by a two-compartment model, the drug first distributes to tissues in the central compartment and then distributes more slowly to the rest of the body. As a result, the concentration time profile has two phases, the first showing a more rapid decline, followed by a slower decline after the drug has distributed throughout the body and concentrations in the plasma are lower. This brings us to the first pharmacokinetic parameter to be introduced in the course, the volume of distribution. We know how much drug we have given to the patient, that's the dose, and we can measure the concentration of the drug in the blood or plasma or serum samples. So the volume of distribution is that parameter that allows us to quantify the extent of distribution by relating the concentration of the drug that is measured in samples taken from the blood to the amount of drug that we know is in the body. In other words, the volume of distribution tells us how extensively a drug is distributed through the body. If the volume of distribution is small, the drug is not widely distributed and typically confined to the bloodstream. On the other hand, the more extensively the drug is distributed, the lower the concentration measured in the plasma and the higher the volume of distribution. Sometimes the volume of distribution can be much higher than the total volume of the body, which seems physiologically impossible. But all this means is that the drug is concentrated in one or more of the tissues outside the bloodstream, so that concentrations measured in samples taken from the blood are very low. Finally, we need to point out that if we're using the dose as the value for the amount of drug in the body to calculate the volume of distribution, we must remember that as soon as the drug is administered to a patient, the body starts getting rid of it through processes of elimination. So we need to use the concentration that is measured immediately after drug administration before a significant amount of the drug has been excreted to calculate the volume of distribution. But it is sometimes practically difficult or even impossible to take samples so soon after drug administration. So what we do is back extrapolate from the first measured concentration to estimate the value that gets plugged into the equation to calculate the value of the volume of distribution. We'll talk more about this later.